It is 6:30 p.m. in Mankon Mezam Division of Cameroon's Northwest region. Good evening and thanks for joining me on the primetime edition of news on My Media Prime Television, coming to you live from our headquarters in Douala, Cameroon's economic capital. My name is Fon Quiter. The news starts now. After beef, the price of chicken is equally witnessing a rapid increase in local markets across the country. Joyngong talked to some chicken vendors at the Bonamusari market here in Douala 5 municipality, who blamed the phenomenon on an increase in the cost of production. Here's our report.
Chicken is one of Cameroon's meat of choice for household meals, but consumers have recently been experiencing the numbers sticking up on their market lists. The same weight and size of chicken being sold for twice its regular price, and in some cases, the meat looks underfed. Chicken vendors explain that with the cost of chicken feed, energy and transportation increasing, they have no choice but to up their prices. In the past, chicken was less expensive than now because of several reasons. First of all, the high cost of primary factors of production like soya beans and maize. A bag of feed has moved from 13,000 to 20,000. Chicken sold at 2,500 francs yesterday is 3,000 francs today. We also have difficulties in transportation. Workmanship equally has increased. This automatically affects the price of chicken. The Anglophone crisis has made the high cost even worse. We used to restock from feed production firms in the northwest and southwest, but following the crisis, we can't go there anymore, and the firms there have equally closed down. The solution to this problem, the vendors propose, is to invest in the agricultural sector to aid poultry farmers. The state needs to accentuate more on agriculture because there is a lack of soya beans and maize. These make up the primary factors of production. Without them, poultry farming is impossible. More efficient solutions, according to this vendor, had earlier been suggested to the Cameroon government. We have requested that the government provides tractors to aid farmers in each region. If these equipment were put at their disposal, we would not have these shortages of corn, soya beans, and chicken would be sold at very much affordable prices to Cameroonians. In May last year, poultry farmers and vendors in Cameroon staged a sit-in protest in Yaoundé, calling on the authorities at home and abroad to loosen trade restrictions put in place over the COVID-19 pandemic and avian influenza, which had more than doubled the price of chicken.
In a related story, the price of a kilogram of beef in Douala still stands at 3,500 francs, unlike in Yaoundé, where a kilogram of beef is sold at 2,000 francs following orders from the Ministry of Trade. Catherine Kongwe visited some beef vendors in Douala, the nation's economic capital, and put together this report.
Unlike Yaoundé, where a kilogram of beef is now sold at 2,000 francs instead of 3,500 francs, respecting the orders of the Minister of Trade, Luke Baga at Tangana, Douala is yet to benefit from the reduction in the price of beef. Some butchers and beef buyers at the Bonamusari market attest that the price of a kilogram of beef is still sold at 3,500 francs. The price of a kilogram of beef without bones is 3,500 francs. But before, we used to sell at 2,500 francs to 3,000 francs. Now, it is expensive because even the transportation fees are high. It is not easy. As you can see, I still have enough beef to sell, unlike before, where by now I would have sold everything. Times are hard and the price of beef too is really expensive. Many people don't buy, so it is really not easy with us. Answering the question of why the prices are yet to be reduced in the market, this butcher says because they also buy expensive from the bush markets. Beef is expensive in the bush markets, and you know some of us who buy in small quantity, they don't reduce our prices, unlike those who buy much. People who have supermarkets always buy in large quantity, and they reduce prices for them. Someone like me who just buys small, they don't remove anything. When people in the supermarkets go and buy, they can reduce prices for their customers. But some of us who buy in small quantity and expensive, it is not possible to reduce the price. Customers on their part are not finding it easy to manage the high cost of beef in the market, forcing them to take other options. Now that beef is expensive in the market, I hardly cook beef in my house. It's better I buy my dry fish and cook my food. I can't take 3,500 francs just to buy a kilogram of beef. It's very expensive. I just buy, but seriously, I am not happy with the price. Everything now is expensive. They need to reduce the prices. If not, we won't be able to cope. Following a meeting held between Trade Minister and the Association of Butchers in Yaoundé, a kilogram of beef without bones in the nation's political capital for over a week now is being sold at 2,000 francs CFA, as there is hope that consumers in other regions of Cameroon equally benefit from the ministerial grace.
Now, health officials in the northwest region of Cameroon have raised concerns regarding limited supply of water in health facilities, which may result in transmission of infections as health workers perform their duty. This concern was raised during a capacity building workshop to train frontline clinical staff on hand hygiene. Our northwest correspondent Charles Akeba completes the story from Bamenda.
In a capacity building workshop for hygiene, healthcare associated infections and antimicrobial stewardship at the Baptist Center on October 26, 2022 on the theme Igniting the Future of Infection Prevention and Control in the Country.
Infection, as a health facility, we must be able to monitor our patients to ensure that we reduce the infections to the barest minimum. And then antimicrobial stewardship, what we mean is that we should be able to take good care of the available antibiotic we have so that we will minimize the risk of resistance, so that we can optimize treatment outcomes, and then so that we can also use them for long.
Organized by the Cameroon Baptist Convention Health Services in partnership with Infection Control African Network, the Society Care Epidemiology of America, and the Ministry of Public Health, doctors and nurses during the workshop insisted infections are acute during the dry season as health facilities and medical equipments are not kept clean due to water scarcity, thereby increasing the transmission of infections. The workshop to build the capacity of frontline clinical staff, promote hand hygiene, compliance surveillance of healthcare associated infections, and antimicrobial stewardship.
Prevention and control is not only a strategy for the hospital, it's actually a strategy that is spreading into the community, because some people had TB or COVID-19 from the hospitals and they spread it out. So what we're doing here, we're trying to equip the nurses, the doctors, and the healthcare workers with strategies, with tools, particularly in hand hygiene and healthcare associated infections.
With facilitators from Zimbabwe and Nigeria who on a platform advise clean care is safe care.
We're talking about things we have practiced, things we have seen done in other places, in other countries, and we are sure that if our colleagues will interact with them very well and they also adopt that skills, and more importantly set up the same systems in place, we'll be able to take care of the patients in this part of the world, in Cameroon, in a safer way, and then help make our society safer and strengthen the healthcare system.
The Cameroon Baptist Convention as a system, its director, Professor T. Pius Mufi Salud, have not spared any effort since 2002 till date to promote infection prevention and control in the Cameroon Baptist Convention Health Services facilities.
Now, the Southwest Public Independent Conciliator has called on youths to join voices and sensitize the population on the existence and aim of the office. The call was made yesterday in Boya during a meeting with some Southwest youth. Emanuela C. with details in this report.
Bringing together heads of different youth groups in the Southwest region, The Office of the Public Independent Conciliator in this gathering seeks to enhance service delivery to those using the local and regional councils through sensitization. According to her, this can only be done by involving youth who hold a greater part of the population of the country.
Youth are very important. The society, considering that they comprise a huge percentage in the population of Cameroon. They are the future leaders. They are those who can bring a lot of change if especially we go out and transmit information about the missions of this office to our collaborators.
Opening the meeting for effective deliberations, the governor of the Southwest region noted that the youth can only do their best in collaboration in a peaceful environment. He applauded the works of the Public Independent Conciliator and urged her to do more by involving more youth. Instituted by the law of December 2019, the Public Independent Conciliator has chosen to use the youth in order to spread the mission of the office through sensitization and awareness creating.
I expect that the youth will be able to go on the field in an aggressive nature to inform the colleagues who are not here of the presence of this office.
Responsible in settling disputes between users of local and regional councils, it is a new phase aimed at involving the youth every step of the way.
Now, 56 public primary schools in the Douala 5 municipality have received minimum packages. The distribution exercise, which took place yesterday at the Douala 5 Council, was presided at by the Mayor of the Douala 5 municipality, Cynthia Azanu, with details in this report.
The Mayor of Douala 5 Council, Mr. Richard Fon, has donated didactic materials to government primary schools in the Douala 5 municipality. This ceremony, which took place on October 26th at the Town Hall of Douala 5 Council, was aimed at supporting the teachers of this municipality in accomplishing a successful academic year. In total, the Douala 5 subdivision has 56 public primary schools to lead. So we will just call on those responsible in the public establishments to make good use of these didactic materials, because if they misuse it, they will not attain what we are looking up to. I received a portion from the state and I was obliged to add it so that all the 56 schools should be at the same level. According to the representative of the inspector, these minimum packages come to uplift many difficulties faced by head teachers of these establishments. You know, public primary schools are free, so many head teachers have difficulties. That means these minimum packages come to accomplish the expectations of the head teachers. They have to use these materials well to help the pupils. Beneficiaries of these didactic materials have expressed their gratitude to the Mayor of the Douala 5 municipality and have promised to properly use these minimum packages.
These materials are going to help us a lot because we did not have chalks. The chalks I bought when we started school are already getting finished. There are so many pens for teachers, pens for children at school to help us. I'm so happy for the minimum package. Even the rim of papers will help us to type the children exams.
It should be noted that these minimum packages comes as a relief to head teachers to lead these pupils improve on their learning experience throughout this academic year.
Cameroon's Public Health Minister Manawudra Malachi says the government has taken all necessary dispositions to tackle public health emergencies affecting their country. He briefed the press yesterday in Yaoundé to pinpoint government strategies as Cameroon struggles with COVID-19, cholera and monkeypox. Our Central Regional Correspondent Bo Elvis with details.
After studies, Cameroon's Ministry of Health will launch the fifth phase of vaccination against COVID-19 in November. An increase in TDRO tests from around 11% last year to 60% this year has been noticed among at least 8,000 Cameroonians involved in the study, an indication that herd immunity has helped Cameroon in the fight against COVID-19, even though the vaccination rate is less than 10%.
In order to effectively fight against the epidemic, let us remain united and continue to scrupulously observe the measures enacted by the government and World Health Organization. So as our head of state, His Excellency Paul Biya says always, let's protect ourselves. Let's protect our community. Let's protect our country. Anyway, let's protect others. Together, let's stay alive.
Cameroon public health experts will brainstorm on how to better manage public health emergencies during an ongoing national forum that will end on November 11.
During this month, the capacity of the actors of the health system will be built on terms such as the incident management system, surveillance, health information systems, and basic emergency medical procedures.
The Health Ministry recommends respect of basic hygiene measures to stop the recurrent cholera outbreaks in Cameroon.
The Regional Hospital of Ngaoundéré has organized a free breast and cervical cancer screening campaign. This campaign, which began on October 24 and will run until October 28, aims at raising awareness as well as reduce the prevalence rate of cancer, which is a major public health challenge in their country. Nicole Tako takes us to the Demawa region of Cameroon. I report.
It was under the theme, Cancer is Everyone's Business, that the Regional Hospital of Ngaoundéré organized a free breast and cervical cancer screening campaign for the population of Ngaoundéré. This campaign, which runs from the 24th to the 28th of October, aims at reducing cancer, which is a major public health problem in the world in general and Cameroon in particular.
Doing the screening for the breast cancer by palpation, and also we can do echography if we have some lesion. Unfortunately, we don't have mammography, but we are doing palpation and echography. For the cervical cancer, we are doing the viability test. So we do the inspection of the cervix after application of acetic acid and gold. And then we see if there is a positive reaction. We can do a biopsy or we can do a pap smear to analyze to confirm if it's a cervical cancer or not.
Out of 50 women who have undergone the screening, 2 are said to have been tested positive.
So since morning we are already at around 50 patients. And around that 50 patients, we had already 2 positive cases for the breast cancer. And we are doing other exams to organize for their management. And for the cervical cancer, up to now, we do not have a positive cases. So we are continuing with our campaign.
According to this patient, prevention is better than cure.
Yes, they said that there was a campaign saying that they are making cancer, breast cancer test and cervical cancer test. So I came here just to come and make the test because they sensitize us that the sick is killing rapidly, that you have no mercy. When it goes, it means that we should be checking frequently to know that we have people or not, because it's a killing disease.
Cancer of the breast and the cervix have become silent killers for several years now, especially in women. Faced with this situation, the Obstetrics and Gynecology Department at the Regional Hospital of Ngaoundéré has decided to raise awareness by mobilizing women for breast and cervical cancer screening.
Malnutrition has become a global epidemic set to be fueled by low income, unhealthy diet, lack of family planning, thus killing at least 1.9 million people, including children, worldwide. In this report, Bokengo Wadi highlights the causes, triggers, and effects of malnutrition. Take a listen.
Affecting 1 in 3 persons worldwide, malnutrition is an imbalanced dietary intake of nutrients needed by the body that is too much or too little for growth, good health, and well-being. Bearing 4 subforms including wasting, stunting, being underweight, as well as deficiencies in vitamins and minerals. The health condition bears symptoms such as fatigue, dizziness, weight gain and loss, slow growth, muscle weakness, loss of appetite, inability to focus and concentrate, poor memory, bleeding gums, irritability, amongst others. Caused by low income, limited food supply, poor hygiene, lack of calories, carbohydrate, proteins, vitamin, and other essential mineral intake, as well as diseases including cancers, chronic obstructive pulmonary disease, cystic fibrosis, bowel disorder, gastroenterological disease, and more. Malnutrition accounts for 45% of all death cases among children under the age of 5. According to data from the World Health Organization, an estimated 1.9 billion adults are obese, with 462 million more being underweight, and 155 million children under the ages of 5 are estimated to be stunted, that is, too short for their age. Leaving lasting developmental, social, economic, and medical impacts such as mumps, anemia, beriberi, rickets, scurvy, pellagra, hypocalcemia, vision problems, physical disability, dental problems, kidney disease, stroke, obesity, goiter, osteoporosis, iron, iodine, vitamin A and D deficiency, liver failure, type 2 diabetes, hypertension, cardiovascular diseases, and more. Experts say reducing the burden for malnutrition for families, communities, and country depends on each and all. To this regard, family planning, good hygiene, sanitation, moderate physical activity, oral rehydration, periodic deworming, immunization, and most especially eating healthy balanced diet are some recommended ways and strategy to help reduce mortality and morbidity by malnutrition worldwide.
Coming up next, some Cameroonian citizens have reacted to the UAE's 30-day visa ban on nationals from 20 African countries, including Cameroon. Eileen Summer spoke with some of them who attempted answering why the ban was placed and what Africans can do to counteract such decision. Her report.
A total of 20 African countries have been affected by the visa ban placed on its nationals by authorities of the United Arab Emirates. Among the 20 is Cameroon. However, the reason for the ban is still unclear. In a notice issued to trade partners, including travel agents, the UAE authorities indicated that all applications for the 30-day visa should be rejected. Nonetheless, this is happening at a time when many Africans are being violated of their fundamental human rights in the United Arab Emirates, while on greener pasture ventures. According to Sri Lareng Elvis, a peace journalist in Douala, the ban is a wake-up call to all Africans.
The ban should act like a wake-up call to most African countries, and to me, it is slap to Africans because we have decided to focus more on the white man and forgetting that we can do it on our own. Because when you look at what actually the United Arab Emirates they are doing, it's just to make us understand that one day the white man will ask Africans to come back to Africa. So it's high time for some of them to actually come back home and invest in Africa. We have resources, we have land that have not been exploited, and if we concentrate to develop our own country, well, we're talking about Dubai.
Anne-Marie Com, a Cameroonian citizen based in Italy, says the positive side of the ban cannot be overlooked.
Good and there is a bad. If this can help develop Cameroonian industry of tourism, like seriously, it is a big yes for me, because when you look at the number of people that travel to Dubai to go and have fun, to go for the tourism, when you see the amount of money they go and spend there, you understand that if the money could stay in Cameroon and be useful to our country, this was going to be a very, very, very good thing.
Nonetheless, diplomatic implications of the ban is the raison d'etre of the decision, as diagnosed by Foba John Ndefo, a barrister at law.
Applications, all of them have been rejected, and those pending have been sent back. Many people hold that the exact reason is because many people who come in under this category of visas have the tendency of coming to overstay their visas. That is the experience I've had in the past, and they don't want it to repeat itself, especially in an event like this where the World Cup is in a few weeks ahead. And we all know that Dubai is the business hub, the attractive hub of that region, that part of the continent. And they will not like a situation where they have an influx of people who don't have particular things to come and do in their country.
However, those going to Dubai for genuine reasons will now have to pay the price.
What about those who are going there for genuine reasons, those who are going there for real business, who actually want to go and spend exactly 30 days or less? What happens to them? So they are caught in this web. They are caught in this web of the unfortunate ban. I don't know, but I think it's highly diplomatic, and it will solve only, this matter will be resolved only through such.
And to sports, Andre Onana's Inter Milan and Choupo-Moting's Bayern Munich have progressed to the round of 16 of the UEFA Champions after the Lions made contributions in this game. In the meantime, Samuel Eto'o has been acknowledged as Fecafoot's best president ever by some regional or league club presidents. Magdalab Eyong-Besong with details.
Back-to-back goals from Eric Maxim Choupo-Moting at club. Bayern Munich, the 33-year-old, scored again against FC Barcelona yesterday in the UEFA Champions League group stage game. His contribution in the 3-0 win has helped Bayern progress to the round of 16. The indomitable Lion, who wasn't called up to the national team for the pre-World Cup friendlies, is clearly paving his way into the final list for the 2022 Qatar World Cup after scoring 5 goals in 4 matches as starter for the German club. This victory for Choupo-Moting's side has caused Barcelona to be relegated to the Europa League for the second consecutive time. Andre Onana, on the other hand, kept a clean sheet yesterday in their 4-0 win against Victoria Plazen in the Champions League group stage game. His clean sheet has contributed to Inter's progress to the 8 finals after completing their qualification in grand style. Onana, who is Cameroon's first choice keeper, has conceded 7 goals, made about 13 saves in all games played for Inter this season, and has kept 2 clean sheets. Away from that, Fecafoot president Samuel Eto'o has been recognized by regional league club presidents as best president of all time for his quality of service rendered to the Cameroon Football Federation in rebranding football in the country since he was voted in last December. His honorary diploma was handed to him on Tuesday at the Federation's headquarters. This comes as reward for job well done so far, as his efforts did not go unnoticed.
Ladies and gentlemen, we've come to the end of today's edition of Prime News on My Media Prime Television. Coming up just after the news is Prime Hour with Kum Leonard and his team. My name is Fon Quiter. Good night.
Black